If you're someone who feels disenfranchised by the healthcare system, feels overwhelmed with health information, or finds it difficult to communicate with your doctor or healthcare team, then this video is for you. In this section, we'll look at key concepts of patient empowerment and how you can take steps to navigate your healthcare system and make more informed decisions. Patient empowerment is not a new concept, but the ways individuals utilize their power is evolving all the time. Patient empowerment is based on the idea that those who are proactive, informed, and invested in their health make better healthcare decisions. They are partners with the medical teams, health professionals, and organizations that handle their treatment and care. Dr. Tom Ferguson coined the term ePatient to describe individuals who are equipped, enabled, empowered, and engaged in their health and healthcare decisions. As a pioneering physician, author, and researcher, Tom Ferguson studied and wrote about the empowered medical consumer and about online health resources for patients and health consumers. He predicted a future in which patients would be recognized as a valuable new type of resource, managing most of their own care, providing care for others, and participating fully in shared decision-making, patient-initiated research, and self-managed care. When these individuals or one of their loved ones becomes ill, they research symptoms and conditions to become more knowledgeable about their diagnostic and treatment options. As a result, they become citizen scientists and utilize the internet and technological tools to find information and solutions to their health issues. Being an empowered patient enables individuals to have a more comprehensive understanding of their health conditions and produces better health outcomes. Informed and empowered patients make better decisions when choosing their doctors, diagnostic tests, and treatments. This results in better care for patients. One of the most significant benefits of being an empowered patient is the well-developed knowledge of one's own body and understanding what is normal and what is not. Paired with a curiosity about medical and health information, this can literally be life-saving knowledge. A survey by the National Patient Safety Foundation found that 42% of U.S. adults reported that they or someone they knew had personally experienced a medical error, and the Institute of Medicine has estimated the number of hospital deaths due to medical errors at 44 to 98,000 annually. Other frequently cited studies have placed the number of deaths as high as 250,000 deaths per year, which would make medical errors the third leading cause of death behind cancer and cardiovascular disease. Data from European Union member states consistently report medical errors and healthcare-related adverse events occur in 8 to 12% of hospitalizations. Infections associated with healthcare affect an estimated 4.1 million patients, or 1 in 20 hospital patients on average every year. In fact, 23% of European Union citizens claim to have been directly affected by a medical mistake. 18% say they have personally experienced a serious medical error in a hospital, and 11% claim they have been prescribed the wrong medication. Evidence on medical errors shows that 50 to 70.2% of these errors were preventable. It's becoming increasingly important for patients to have their own patient advocate, as medical mistakes, adverse reactions, and hospital-based infections are becoming more common. A patient advocate can be thought of as a supporter, campaigner, or spokesperson for the patient, and this can be a family member or close friend. Independent, professional patient advocates are also growing in number. They share the healthcare provider's goals of doing what's best for the patient, but they also see the situation from a more holistic view, a point of view that may not be available to the patient's doctor. The healthcare industry's culture of denial and complacency around medical mistakes only adds to patients' concern and forces them to adopt a healthy dose of skepticism around their doctor's recommendations. Doctors are trained to have a working knowledge of most conditions, and through specialization and practical experience, even more knowledge is gleaned throughout their careers. This vast amount of information is spread out over a broad range of medical conditions and hundreds of patients. Equally important is a patient's own knowledge of their medical condition. They are often specialists of their own health problems and may know more about current research and treatments for their condition than their own doctor. Practical coping skills of living with a condition may also be developed and fine-tuned over many years of patient experience. This combined knowledge between a doctor and their patient can complement each other and provide a greater understanding of a particular health condition. A century ago, a physician could remember all the medical information required to treat most known medical conditions. There simply wasn't as much to remember compared to today. Over the past century, medical information has increased exponentially, but the capacity of the human mind to store and process it has not. It is no longer possible for a doctor to remain up to date on every medical condition known to man, let alone new conditions. For patients, this means it's up to them to research their symptoms and conditions, as well as find others like themselves who share similar health experiences. Since the advent of the internet, ePatients have become increasingly common. They know what they are looking for and how to find it. Some of them may end up knowing more than their doctor about specific aspects of their condition. As a result, ePatients are driving a healthcare revolution, gathering data on symptoms, finding better treatments, and insisting on better care for themselves while providing other patients with invaluable medical assistance and support. The old paternalistic view of healthcare, in which health professionals were seen as the authority of all medical knowledge and wisdom, is gradually giving way to a new evolving paradigm in which patients, caregivers, and social networks are increasingly seen as important sources of real-world health data. The healthcare system is becoming more patient-centered because patients are demanding more input in their care and recognizing their own authority and capacity to make health decisions. But is empowerment actually the term we should use? Some people dislike this term because it implies that some higher-level official is granting the patient rights and powers that they do not already hold, instead of recognizing and respecting the inalienable rights of the person. As if somehow patients need to be crowned with the authority to manage their own health and well-being. Other commonly used terms include patient participation and participatory medicine. These terms also describe a situation where patients and health professionals listen to one another and actively collaborate in finding solutions to health issues. Whether you prefer the term empowerment, participation, or something else, the patient empowerment movement is essentially about people empowering themselves to find answers and make informed decisions. Rather than being given power, they are discovering the power they already hold. Now that we understand what patient empowerment is, let's look at some of the key traits of an empowered patient. Understanding the basics of patient rights, including such things as informed consent, the right to obtain one's medical records, and the right to a second opinion, is an essential characteristic of an empowered patient. Having access to health information from a wide variety of sources, including books, online resources, educational courses, and social networks, is also important. Access to information is fundamental to patient empowerment, and patients make the best decisions when they are armed with accurate, relevant, and accessible information. Another essential component of patient empowerment is health literacy. Health literacy is defined by the National Library of Medicine as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Without health literacy skills, patients may find it difficult to navigate the healthcare system. They may also find it difficult to self-manage their own care, leading to poor decision-making. While digital literacy may not always be critical to patient empowerment, it can increase access to information and the speed with which it is obtained. Cornell University defines digital literacy as the ability to find, evaluate, utilize, share, and create content using information technologies and the Internet. Many patients have found online communities that have proven to be life-saving in some cases. These peer-to-peer support systems rely on individuals having basic digital skills to find others like themselves in the online world. Self-efficacy refers to an individual's belief in his or her capacity to execute behaviors necessary to produce specific performance attainments. Self-efficacy is important because it can play a significant role in health psychology and how people manage their health, such as eating healthy, quitting smoking, or confronting an illness. The good news is that self-efficacy is a trait that can be learned and improved over time. Part of being an empowered patient also means having the ability to choose a doctor who understands that medical decisions are a collaborative process, a process in which patients should be involved from the very beginning, and the result is a decision which reflects the physician's medical knowledge as well as the patient's values and beliefs. Therefore, the patient-provider relationship is built on trust and mutual respect. Knowledge of the history of medicine can help to empower patients to understand how societies have changed in their approach to illness and disease from ancient times to the present. From the Hippocratic Oath to germ theory to Koch's postulates, understanding the history of medicine provides a greater perspective on how diseases and other medical conditions are diagnosed and treated. Principles of the Nuremberg Code and the legacy of health professionals' involvement in the atrocities of the past is critical to understanding virtually every aspect of modern medical ethics and underscores the need for patients to take an active role in their health care. The patient empowerment movement is essentially about giving patients a voice in their healthcare and the tools to make informed and collaborative decisions with their healthcare providers. Patients are empowered when they are not just passive recipients, but rather they are active participants in their mental and physical health and well-being.